Okay, so imagine you're working with somebody who doesn't really want to talk to you. They're not making eye contact. It's like no matter what you do, they won't consider your perspective. And it's kind of feels like maybe they're just not paying attention to you. These people can be like really hard to work with, and maybe you've worked with people like this already. But a little bit based on the description I gave, these people could maybe meet the criteria for autism spectrum disorder. You might know somebody who has autism spectrum disorder just because like the rates of it being diagnosed have been going up a lot over the past couple of years. So a little bit about autism spectrum disorder first. It is a developmental disorder, not a cognitive disorder. People like get driven up the wall about people confusing the two. A few of the more inclusive symptoms, according to the DSM, are that you have trouble with social interactions, and this is with interpreting emotions or sharing emotions, and you have trouble interpreting nonverbal behavior. And you kind of tend to like repetitive or like strict schedules, and deviating from that can be really upsetting. There's also different levels. That's why it's called a spectrum disorder. So at the lower end of the spectrum with like the less severe symptoms is what used to be called Asperger's syndrome. It's not in the DSM anymore, but people who had that were, they were highly intelligent, and they would be really interested in one topic, and they would learn all about that one topic. And they would, they appear kind of socially awkward, so that like deficits in social interactions, not too severe, but they just kind of like seem awkward. At the other end of the spectrum, not quite like the maximum, most severe end, is pervasive developmental disorder. So again, the symptoms are just a little bit more severe, so they might have like deficits in motor skills or language altogether. They might not be able to speak. They're really sensitive sometimes to lights, sounds, or touches. So like any disorder, autism has had like controversial issues. One right now is awareness versus acceptance. And I know both sound like really inclusive terms that would like be really important for any kind of disorder or anything really. But awareness lately has had this negative connotation that we need to like draw attention to this really large issue. And people are wondering why exactly is having any disorder an issue? Like why can't it just be considered a form of diversity? And I think this brings up a lot of important points, because having any disorder doesn't make you any less of a person exactly. I think it's just that you aren't fitting into that mold of what we considered normal. And people are wondering, like, why are we being, like, forced to fit into this mold, and why are they trying to, like, fix us through treatments and therapy? And an example of a disorder that used to be a disorder and it's now considered a form of diversity is homosexuality. So it wasn't taken out of the DSM until 1973, which really wasn't all that long ago. You know, it feels like a long time ago. But now we just consider it a form of diversity. We wouldn't ever really call it a disorder. It's just like a difference in preference. And I feel like that may be where autism is starting to head, especially the more Asperger's, lower symptoms, less severe side of it. And I think that it's really important that I think therapy is really important and treatment is really important. I'm not trying to like discount that in any way, because people, especially at the lower end or the more severe end, need help with coping and adapting. But I don't think that we need to like try to fix people, or that we need to like eliminate their symptoms. I think we should see it as a form of diversity, and our therapy and our treatment focuses should definitely be more on inclusivity and trying to make life better for them, instead of trying to make it like easier for us to accept them into. So really, I think we should be focusing more on acceptance rather than awareness, but I think awareness is still important. We still need to be like aware that there is an issue, and that's how we lead into acceptance. That's all I got.